Hi, Mayor Al here, and we're at Joint Motion in Scotch Plains on Park Avenue. It's a great place to do physical therapy, and Tristan is the owner-operator. And Tristan, why don't you tell them about what kind of therapy you do, how you do it, and how they can sign up?
Sure, thank you, Mayor Al. I'm just going to remove my mask so I can discuss a little bit. So we are an outpatient physical therapy office. We've been in business for 14 years, luckily, and thankfully we made it through some tough times, but we're back here, we're open and ready to serve anyone's orthopedic needs. If you have aches and pains, strains, if you had surgery that was just scheduled, we're here to take care of all those kind of issues for you guys. We're open Monday through Friday right now from 7 a.m. to 8 p.m. We've been reducing our volumes so we don't have too many people in the gym or office at any time. We have been meticulous about wiping down all of our equipment religiously after every patient. We're all wearing masks, except for right now if we're talking. Otherwise, we're here to serve the people of Scotch Plains, Fanwood, and their surrounding areas, and we're doing it happily. So.
Okay, and Deputy Manager Heisey, you have any thoughts?
I do. Well, I have thoughts always and questions. Do I need a prescription if I want to come here, Tristan, or can I just make an appointment on my own? Or does that depend on insurance?
So it depends on your insurance.
Okay.
That's the right way to answer it.
Okay.
You do not legally need a prescription. Anyone can receive physical therapy services without a prescription. Some insurances will cover it. Actually, most of them do now without a prescription, but there are a few that still require one. So what we usually do is we'll have the patient call, and then one of the front desk people will take all their information. We verify the benefits, and then we'll let you know if it's something that needs one or doesn't need one, or what your insurance coverage might be. We do a lot of that legwork for the patients on their behalf. So.
Thank you. And then my other question is, because of the change in how we're all working now, a lot of us working from home, I mean, even before COVID, we're all on our phones a lot more than we probably should be. Are you seeing an uptick in how your diagnosis or your treatments have changed over the past 14 years?
So that's actually a good question. I would say that for the most part, we still get a lot of our typical patients, but we have been seeing a lot more people who are working in environments that they're not used to working in. They're working from home remotely. They don't have the proper ergonomics set up at their desks like they would have at work. And so we're getting a lot more neck and back pain and wrist pain and strains, that sort of thing, that more than we typically have seen. And so a lot of times the recommendation is you got to fix your desk at home too. If you're going to be working at home for 40 hours or more, a lot of people at your computer, and you're sitting on your couch, or you're sitting at your kitchen table, that's not the right ergonomics.
Oh,
and you
I
have to
know.
maybe go to Costco or BJ or whatever it is to get a better desk chair or task chair. Maybe arrange your height of your monitor, or get some other kind of monitor device to raise it up, or a lot of popular options in the standing desks now. So yeah, that's definitely something we've been seeing a lot more of.
Okay.
All right, and Margaret has a standing
And I
desk.
have a standing desk in my office and I have a pad for it. And I'm going to throw one more thing out there. I know this will now get long. That I want to talk about is, do you offer a service where you'll go into people's offices and kind of do an assessment? Because I've been saying this, I go to a chiropractor, and I've said for a while, can you come fix my car? Can you come, check how I'm sitting in my office? Am I on my Peloton correctly? Because that's really, it's like anything else. It works really well when you're here, but let's bring it out into the real world. I can't talk with the mask. You know what I'm saying there?
Yes, I know, but what's a chiropractor?
What the?
That's a personal
That's
choice.
it, yeah.
All right.
We do not offer that service per se as far as going to people's houses. We just don't have that chance. But I will say what we have done, and one of the benefits of the current times is we did adopt telehealth, and so we've been doing a lot of telehealth treatments.
Oh, awesome.
And so what we can do is get a view inside someone's house now.
Right.
Where previously we would not have been able to. And so sometimes we could even do maybe a telehealth. That'd be a great use of one. So you know what? If you can do a telehealth appointment with me, I'll show you where I'm sitting, what my chair is like.
I love it.
And we can make recommendations like that, which we were doing a lot more during the more strict quarantine times. But we do go to people's cars and things like that.
So another great service that you provide as times are changing. So thank you.
Okay, and finally, but not lastly, we have project coordinator for development, Tom Stroh, who can give a personal testimony as to how good Joint Motion is. Go ahead, Tom.
Well, I was a patient here about 2 years ago. I needed some physical therapy. I had a fracture in my lower back from an accident, and these guys fully took care of me. They have great staff. Everybody here is friendly and fantastic. Took care of everything I needed to do. Went through the whole program and came back much stronger. So I wholeheartedly endorse Joint Motion, and I encourage anybody to come here if you ever need any
Thank you, Tom. But Tom was a great, fantastic, compliant patient, and he was easy to work with. So
That always
it was
helps.
always pleasant. So thank you.
All right.
All right, everybody, so thank you very much. Our business of the week, Joint Motion. If you need physical therapy, come on down here and use them. Have a great day.
Thank you.